Veterans, a mental health struggle. This presentation is brought to you by Milena, Taylor, Talia, Sabrina, Victoria, and Estefany. Today's topic covers veterans and their health-related issue, which is mental health and post-traumatic stress disorder. The following learning objectives are aimed towards student learning outcomes. After viewing the video presentation, 50% of the student viewers will be able to identify which gender within the veteran population suffers the most from mental health disorders or post-traumatic stress disorder. After viewing this video presentation, 50% of student viewers will be able to identify at minimum one high-risk behavior that is associated with a mental health disorder or post-traumatic stress disorder among veterans. Finally, after viewing the video presentation, 50% of student viewers will be able to identify at minimum one factor that serves as a barrier for veterans to seek treatment concerning mental health and post-traumatic stress disorder. In order to gain an in-depth understanding of the mental health-related issue at hand, it is important to first understand cultural competencies that come into play when considering the veteran population. We do this by examining a number of barriers that stop veterans from seeking treatment for mental health-related disorders. We first examine embarrassment. So a lot of veterans carry around personal embarrassment about their mental health-related issues after being discharged from the military. In addition to that, they carry around shame in admitting that they have a problem and even admitting that they actually need help to solve their issue. With relation to the tough foundation that they have been utilizing throughout their service, they carry around fear of being seen as a weak individual when it comes to having a mental health-related disorder. Now, in addition to that, it is crucial to understand that there is a lot of negative stigma surrounding mental health-related issues and also their treatment. So, a lot of times, veterans may even lack the awareness and the understanding that is necessary to realize that one may have a mental health related issue and the fact that they may need to seek treatment for this. This is really important because a lot of veterans need to be educated on that certain topic and given the proper awareness that they do have a problem and that they really need to seek treatment in order to be healthy individuals. Now we should focus to discuss specific epidemiological data in concerns to the mental health-related disorders found in the veteran population. In 2011, over 1 million veterans being treated in a patient-aligned care team were diagnosed with at least one mental health disease among the following list of diseases, which include depression, PTSD, anxiety, substance use disorder, schizophrenia, and bipolar disorder. Among that list of diseases, depression seemed to be the most common, and 100,000 cases of schizophrenia were also recorded. Among hospitalized veterans, 20% of them were diagnosed with a mental health-related disorder. From the year 2004 to 2013, there was a noticeable 30% increase in the amount of mental health diagnoses that were being made. Among veterans who were discharged from Iraq or Afghanistani posts, 20% of them experienced post-traumatic stress disorder or even depression. Next, we examine epidemiological data as it concerns gender differences in the veteran population. It was reported that 85% of women veterans experienced a traumatic event during their time of service. In relation to any sexual trauma, incidents reported by veterans who were women were far greater than any incidents reported by veterans who were men. In addition, post-traumatic stress disorder is 2 times more likely to occur in women than in men veterans. Going one step further to discuss the actual prevalence of post-traumatic stress disorder among these two genders, we see that about 10% of veterans who are women develop post-traumatic stress disorder, in comparison to only about 4% of men who are veterans who also develop post-traumatic stress disorder. In order to grasp the importance of this mental health-related problem among veterans, it is important to also consider the detrimental effects and the concerns that this mental health-related issue has on the given population. In the United States, the warfare dynamic changes constantly. As this changes, there has been a seen increase in the amount of mental health-related injuries. Due to these changes, we have also seen an increasing diagnosis in post-traumatic stress disorder among veterans. Now, as these diagnosis cases increase, they are linked to the direct negative effects, which include suicide and homelessness. According to statistics provided by Hester, we view that about 20 veterans suffering from mental health related disorders commit suicide on a daily basis. In addition to that statistic, we view that there are over 100,000 veterans who suffer from mental health related disorders, who also suffer from homelessness on a daily basis. Now, taking into consideration some statistics provided by the National Veterans Foundation, we can also see that specific veterans who prior served in Iraq or Afghanistan suffer from different detrimental effects as well. Now, taking into consideration substance abuse issues. So we see that 25% of veterans who served in Iraq or Afghanistan suffer from substance abuse. In 2009 specifically, there were about 10,000 cases of alcohol dependence reported among individuals who were veterans who served in Iraq or Afghanistan and suffered from mental health disorders. In addition to that, we must address the statistics of post-traumatic stress disorder as they relate to brain injuries. Now, as I mentioned, as that dynamic is changing and the mental health related injuries are increasing, we see that the injuries to the brain result in the development of post-traumatic stress disorder, and the fact that it is 2 times more likely to develop post-traumatic stress disorder if one suffers a traumatic injury to the brain. In order to continue with the detrimental effects and concerns, we can inspect the lack of access to mental health treatment among this veteran population. So, according to Hester, we see that there is a lack of access associated with mental health disparities, and this is linked to the suicide rates as mentioned before, in addition to the statistical prevalence of post-traumatic stress disorder diagnoses and the occurrence of depression, which both can lead to the increased suicide cases mentioned before as well. Now, moving even further to address specific interventions and recommended measures taken into consideration to decrease the amount of mental health diseases among this population, it is important that we increase access to necessary treatment options for this specific population. This can be done on a local and state level, and in order to do so, collaborative measures must be taken from nonprofit service providers along with public health service providers in order to successfully decrease the amount of health-related diseases among this population and to actually increase the availability of intervention, of crisis intervention specifically, and mental health services for this population, among which have served a very significant time for our nation. According to the National Veterans Foundation, it is crucial for the government to increase their funding in relation to providing treatment services for mental health among this population, along with implementing early detection programs. Now, these programs would consist of specific screenings that would determine whether or not an individual suffers from a mental health illness. In addition to that, guaranteed services to these individuals would be implemented as well post-discharge in order to help them maintain a healthy mental health, in addition to providing specific treatment options if they are truly suffering from this disease or any other mental health care diseases. Go one step further and look even deeper into a specific intervention program, we continue our discussion about interventions and recommended measures by now discussing the suicide prevention intervention program specifically. Now, this specific intervention program raised awareness by increasing accessibility to treatment options in concerns to the mental health of veterans. By collaborating with substance abuse services along with mental health services, it provided treatment options for veterans who were suffering from co-occurring disorders. With that in mind, it also provided crisis lines along with screenings, which were done either, as I mentioned previously, through a self-assessment or professional assessments done by healthcare providers in order to determine whether or not a specific veteran has a mental health care disease. Now, along with that, we have suicide prevention surveillances that were able to detect any suicidal thoughts or actions. Now, according to CATS, for this specific intervention, we have a decline of 10% in the rate of suicide, along with a 15% decline in the standard mortality ratio. Now, that being said, we see that this specific intervention program provided specific treatment options for these individuals. In part, given those previous statistics, we still see that there is a difficulty to access such treatment programs. With that in mind, it's important to continue raising awareness and try to limit certain stigmas associated with mental health care and understand specific cultural competencies, as mentioned before, in order to actually provide these individuals with the proper treatment that they need. Because of their importance to our nation and their devotion and service to our nation, it is in our best interest to give them the best and most effective treatment in regards to their mental health problems and diseases so that they too can live their life to a full potential. To end it there, I thank you for listening. And these are specific references that were cited in the presentation.